episode of The Daily Blend. I am your host, AC. And if you happen to get this magazine in your mailbox last month, you might be wondering, who is this dapper gentleman on the front? Well, joining me today in studio is Mr. Ric Ransom, the new CEO of MU Healthcare. How are you, Rick?
Wonderfully well today, Adonica. Thank you for having me on the show.
Oh, absolutely. We are excited to chat with you. So, Rick, I have heard the story of your background, and I think our listeners and watchers would be really interested to know, how did you get to be in the profession that you're in today?
Well, the story is probably non-traditional. So I am originally from Birmingham, Alabama. My dad is a retired physician, and I actually have a younger brother who is a physician. So I was the kid in the family who passed out in biology class.
Okay.
And didn't really have the aptitude in science that it really requires to be a clinician. So I went to undergraduate at Morehouse College in Atlanta and got a degree in philosophy. I ended up choosing to go to law school, and I didn't have a great sense for exactly what lawyers did.
Okay.
So I actually toughed it out with law school, practiced for 3 years, and after doing that for 3 years in rural Alabama, decided that I wanted to find another way to try to be of service, be of use to the community. Went back to school to become a hospital administrator. So I've been working as a not-for-profit hospital administrator for the past 25, 26 years in multi-hospital, mostly academic health systems.
Yes. And so that brought you here, and you came here from Wisconsin, correct?
Madison, Wisconsin,
Yes.
most recently, yes.
Yes, absolutely. So we got a chance to go on a leadership visit with the Columbia Chamber a few months ago to Madison, and you had a chance to join us on that trip. You had just moved to Columbia. I'm sure that was a little interesting for you.
It was wonderful in some weird ways.
Yeah.
So being able to go on a trip to a place where my family still was living,
Yes.
was absolutely interesting. And I think from a community standpoint, being able to participate in the tour with the chamber and know a little bit more about the community in Madison was also valuable, I think, for the group.
Yes, it's interesting how you can learn things even though it's somewhere that you've lived before.
Absolutely.
Yes, so I know we are in a period of huge growth at the University of Missouri healthcare system. Tell us a little bit about what is going on with the system right now.
So we've got a lot of good things going on. Probably the thing that is most noteworthy, we're right on the heels of bringing Capital Region Medical Center into the family.
Yes.
We fully integrated January 1st, added a 100-bed hospital, 30 clinics, 1,300 to 1,400 new team members
That's
that are
amazing.
all part of the family at MU Healthcare. In addition to the work with Capital Region Medical Center, I'm also thrilled that we've got our new Children's Hospital and Birthing Center that will be opening up in the next several months. And both of those additions into the healthcare system really represent big advances in the ability of MU Healthcare to save and improve lives in Central Missouri.
That is wonderful. And you know, when you talk about a new women's and children's hospital, I know that there's a lot of talk in the community about it. A lot of people are excited. And is it adding an additional, what is that, 144 beds? Or?
Yeah, it's about 140 beds, and it is going to be wonderful for our littlest patients, wonderful for the care teams that provide for them, and wonderful for the people in Central Missouri as well.
It's amazing. And so you mentioned the acquisition of CapReg and CapReg joining the team here with MU Healthcare. And so I'm excited about that because that provides care for people who are not living right here in Columbia, but the surrounding areas. How important are those systems to be in place for the people who live in the surrounding areas?
I think it's critical. And I think the story here in Missouri is really consistent. Here, we've had probably 10 different hospitals close in Missouri since 2012. And so at a time where there's a lot of pressure on rural community hospitals in Missouri, the role of MU Healthcare as really the backbone of the care delivery system has grown in importance. And so being able to expand capacity and add Capital Region Medical Center, they're wonderful doctors that have practiced there for many years that are now part of the MU Healthcare family, being able to take those wonderful resources in Jefferson City and convert them into use for people in a broader geographic area, I think represents a win for patients and a win for the community.
I would absolutely agree. And we sincerely hope that all the rural communities around agree as well, and we welcome them into the MU health system. We're excited to have you leading us. Now, I want to ask you a few things about your time here in Columbia.
Okay.
Because I know integrating in a new community is not always the easiest thing, but I read that you found some things here that you were pretty happy with. Restaurant wise, I know it's not easy coming here and your family's still back home, and so you're kind of, you're out here on your own. What have you found here that you're like, I dig that, I like it?
So my story has been that this has all been in the name of science.
Okay.
Right? So
okay.
all of my experimentation with local cuisine has been in the scientific spirit. I've been really happy with the move to Columbia for a lot of reasons.
Yes.
The wonderful restaurants has been a big part of that. I'm an ice cream fan, and so I've become a big fan of Central Dairy.
Really?
Down in Jeff City. I also have, I spent some time in Memphis, and my wife is actually from Memphis, so I'm a big barbecue fan. So Bud's Barbecue, Como Smoke and Fire. There's some really good barbecue places here in Columbia as well.
Were you surprised about that?
I was pleasantly surprised.
Yes.
And then the thing that I actually read the most about was Shakespeare's Pizza.
Yes.
And that's been awesome as well.
Yes.
So my kids are more pizza fans than I am.
Of course.
But again, in the name of science,
in the name
I've
of
been
science.
Trying Columbia's fine dining one place at a time.
We appreciate you. I'm sure all those restaurateurs appreciate you coming in the name of science.
In the name of science.
I like, you know what? I think I might adapt that. In the name of science, I have to make sure that I try all the restaurants around Columbia.
It's the right thing to do.
You know what? I like you. It absolutely is the right thing to do. Ric, thank you so much. We appreciate your leadership for MU Healthcare, for this community. I know you're going to be a community guy, I can tell. You want to jump out and get things going. We appreciate you, and thank you so much for joining us on The Daily Blend.
Adonica, thank you for having me here. I really appreciate the opportunity.
Absolutely. All right, we will see you guys next time on The Daily Blend.